Another key provincial jurisdiction that has often and for a long time been abused um, and not providing quality to the people of Ontario has been healthcare. And the Ontario Party again has placed some new and unique elements out there for Ontario voters to select from. I know in my time in elected office, we coined the term about 20 years ago, hallway healthcare in Ontario, because nobody was getting the quality of service that and the quality of healthcare. What is the Ontario Party's view on fixing this broken hallway healthcare system in Ontario?
Well, Randy, our healthcare system keeps on getting worse and worse and worse. And there's many things that could improve our healthcare system. I'm going to go over the points on our flyer first, and I'm going to add some additional points that we can discuss as well. So we want to make sure that the free healthcare that we're paying for as taxpayers is going to Canadian citizens only. And we're seeing, in terms of the masses of people that are here in our province and in Canada, and many of whom that are overstaying their visas and things like this, they're using our healthcare system. And we're hearing things that I've never heard from before. I've heard firsthand from doctors at my local hospital in Belleville, where I live, and they say, we're getting, for the first time ever, we have stacks and stacks of bills that aren't getting paid. They're having people that are coming in, they don't have an OHIP card, they're getting treated, and then they're not paying their bills. So we're definitely having a healthcare usage problem where a lot of people who are not eligible to use our system are using the system and not paying for it. So that's one issue. We also are having a family doctor shortage. And, in my own circle, I know so many people in the last 5 or 10 years that have wanted to become doctors in Canada, but were not accepted into schools in Canada. So my cousin, my wife's sister and her husband, my sister-in-law's siblings and his wife, a friend of mine from high school, all of these people, intelligent people, born and raised in Ontario, they're now doctors in the States. They've studied in Ireland, they've studied in the Caribbean. There is a tremendous amount of Canadians who want to be doctors, who want to live and work in Canada, and they're unable to do so. So we're talking about opening up new medical spots to address doctor shortages. We would make these spots contingent on people agreeing to work in a certain area. There's definitely people in Napanee who want to be doctors, who want to live and work in Napanee. We're going to have a spot for that person. I read an article where, some of our spots are used up by people from, in this article, the country specifically was Saudi Arabia, but they like our education system, but then they're going back and taking their skills back with them to their home country. That's a great thing for that country, but we have doctor shortages here where people are lining up overnight in the winter to get the chance to be on a new doctor's roster. So we need to make sure that we have that system here. It's not fair when we're paying for the education of doctors, but then a local municipality has to pay a bonus of $50 or $75 or $100,000 to even entice that doctor to come work there. So if we're paying for the bulk of somebody's education, we need to have spots dedicated to certain areas, and that's what we're going to do with our new program. One other thing I'll take quickly, our system right now is a sick care system. It's not a healthcare system. We need to make sure there's a lot more preventative focus. That's where we're going to see the cost savings. I know from my experience, my wife is a nurse practitioner. The way our system works right now, family doctors are incentivized. They're seeing a new patient every 5 or 10 minutes. There is not enough time to get to a lot of the underlying causes and that people have, and we're underutilizing our nurses and nurse practitioners. Oftentimes, my wife, in talking with the patient, she gets to underlying issues that have been missed for years and years and years. We can't just keep cycling people through and just putting the latest Band-Aid on the latest cut. We need to get to preventative and a deeper relationship with patients to give them the help that they need. And we've been underutilizing all of our other professionals. Nurse practitioners have the prescriptive authority of a family doctor, but they can't even bill OHIP directly. They have to be employed through some other means. There's many most people prefer nurse practitioners when it comes to a general family health situation. So we need to make sure we're utilizing all of our professionals. This isn't so much about money; it's about doing things differently, and that's what we want to do.
Well, yeah, we know that, again, this has been a problem. When I left office, Derek, here's a figure for people to mull over. In 2022, when I left office, there was 1 million Ontario people without a family doctor. The latest numbers now, and that's just 2.5 years ago, that number has now skyrocketed to 2.5 million people in Ontario don't have a family doctor. But I think this is really important. So you're saying you're going to provide free healthcare, but only to legal Canadian citizens and residents. And if you're not here legally, if you're part of that 2 to 4 million illegal people, you will have to start paying for your own health care. Is that correct?
That's correct. And, maybe we'll say you have to pay up front or something like that. We're seeing a lot of advantage taken from our system here. The other thing that we haven't really spoken about yet is, of course, we want to, and this is something that's done in almost every other country in the world. We're talking about Western Europe. We're talking about countries that, pay for healthcare. The government will pay for healthcare, but they allow the private sector to fill in many of the needs and the spots that are missing. So we need to make sure that we have a public-private model here as well. It's not going to decrease the quality of our care. In fact, it'll increase it. We should not have people having to wait for so long. We have better healthcare for animals in this province than we do for people, and that's a shame. So there's a lot that needs to be done. And we're going to make sure that we make the tough decisions that are necessary to get it done.
Well, that last point is absolutely true. Yeah, you can get healthcare for your dog or your cat much faster than you can for your loved one, your mom or your dad.